This is our mission, to provide care to the migrant and seasonal farm worker.
Healthcare is not only about health. Health is really about the community.
Holistic care is very important. You can't give medicine to someone that doesn't have enough food to eat.
We're in this together. What can we do?
At the time of Prospera last year, there was still a huge amount of uncertainty. We've never had to deal with a pandemic like this before. It really taps into who we are as a community health center.
The outreach department has been with the clinic from the beginning, back in the 70s. They called us Virginia Garcia. They don't know my name, they don't know Rosa's name. So when we go to the migrant camp, oh, hey, Virginia Garcia. I am Magnolia. So this is something that I like to see.
The season is only from May to August. And the people come from Mexico, California, and Washington. And they didn't have this kind of service. For them, it's amazing to Virginia Garcia go where they are and provide the services.
You know, people just think that Virginia Garcia is just medical care. It's more than that.
This is the community that I was raised in. Recently, I had the opportunity to be out at camp. And it was very hot, and so the providers were out in the tents. It was about 4 or 5 hot. I was seeing patients who were coming in who had just finished picking blueberries. They had been on their knees all day in the hot sun, and they had worked longer because they were trying to finish up that particular field. And most of them had back pain, and most of them had swollen knees. And they were so grateful, and they were so glad to see us there. I could see several workers sitting in trailers. The sun was setting behind them. And it just really hit me that they're often forgotten. They would have gone from a hot field straight into a hot trailer, just ready for the next day. And it just made me proud of the work that we do at Virginia Garcia, because we were out there. And so we were able to say, listen, we need to be at the table. We really need to be shaping policy. Lack of worker protections, crowded substandard housing, lack of health care, cultural and language barriers, all conditions of systemic inequities. Health is not only about health care, that health is about all of these other social conditions.
We start serving our patients where they at and with what they already know. Our work as a community health worker is based on equity, is based on inclusion, is based on social justice. The outreach gives us an opportunity to inform our patients. And we volunteer at the food pantry, but we also have patients that it's very hard for them to come and get their food box. I have a family that she is a single mom with 4 little kids, and she lost her job. We schedule every 2 weeks, and bringing this box of food, she was able to ask her doubts and the rumors that she heard about the vaccine, and I was able to help her understand and share. She got her vaccine and her oldest daughter.
We look at the community as a whole. We see that COVID is impacting our community, the communities of color, disproportionately. We have to work beyond the clinic walls, prioritizing the response to COVID-19, It's the single biggest threat to our population, and so that activated all parts of our organization.
We were created in December of 2020. We started 2 days a week going out to employer sites.
We kicked off what we've been doing, and we were asked to go out and do a mass testing event for one of our larger migrant camps. Organized it very quickly, and it was a successful event. A year later, when these workers came back to the same farm, we were offering them all vaccines. For the most part, the patients and the people that we serve have been so gracious and so thankful. And I think it helps feed the soul.
We're able to provide other services. We do a screening for diabetes, and that's a big one because the numbers are rising. It really goes a long way, and it gets people thinking about their health. At one point, we had 250 people waiting, and it was pouring rain that day. It's astonishing.
I think that we were able to reach the communities too because of those true, from grassroots partnerships. Everyone just saying, it's okay, we got you. The county, the lab, the people in the community would drop off snacks and food for us because they wanted to contribute to what we were all in together.
We want to vaccinate 30,000. We're in a much better place than we were a year ago. Even with all the tragedy and all of the suffering that has occurred throughout this past year, I think that silver lining, of seeing people come together is the thing that is really inspirational.